A severe dog bite is a traumatic physical injury, but it also triggers an ancient panic. It brings up the fear of what might be left behind in the wound, an invisible, universally fatal virus. We know it as rabies, but its biological family is the lysovirus genus. Those root words literally translate to frenzy and violence. And while we strongly associate it with stray dogs, the original biological reservoirs for these viruses are actually bats. For thousands of years, a bite from a rabid animal meant certain death. That unbroken streak lasted until July 1885, when a 9-year-old boy named Joseph Meister arrived in Paris. He had been severely bitten 14 times by a rabid dog. He was brought to scientist Louis Pasteur and Dr. Jacques-Joseph Grancher. The two men took a massive, calculated risk. They administered a series of experimental injections that had only ever been tested on animals. The treatment worked, and Joseph Meister survived. Yet today, the virus still kills nearly 60,000 people every year. The vast majority of these deaths happen in developing regions that lack reliable access to vaccines, where persistent myths about the disease cause unnecessary panic and brutal treatment of local street dogs. To stop the spread, we have to look closely at the biology of the virus. Separating the clinical reality from our ancient fears is the only way to protect ourselves and the animals we live alongside. There is a common belief that every stray dog is a walking biological weapon, but in places like the United States and Europe, widespread pet vaccination programs have successfully eliminated canine rabies. The real threat in Western countries comes from wildlife. If a human contracts rabies in the US, it is almost entirely due to a bite or scratch from a bat, a raccoon, a skunk, or a fox. There is another myth that rabid animals can look completely normal while infecting you. To understand why that is false, look at how the virus moves. It doesn't travel through the bloodstream. Instead, it creeps along the peripheral nervous system, inching its way from the bite wound directly toward the spinal cord and brain. Once it hits the brain, it triggers extreme neurological inflammation. This causes what veterinarians call furious rabies. The virus hijacks the animal's behavior, causing severe aggression and erasing their natural fear of humans. You might even see nocturnal animals, like skunks, wandering aimlessly in broad daylight. The other variation is paralytic or dumb rabies. Instead of acting aggressively, the animal appears profoundly sick. They stagger, drool excessively because their throat muscles fail, and slowly succumb to a creeping paralysis. And despite what you see in the movies, animals do not get hydrophobia or a fear of water. That is a strictly human symptom caused by excruciating muscle spasms in the throat when an infected person tries to drink. By recognizing these specific neurological symptoms, you can identify an animal that is actually sick. A neighborhood dog barking aggressively at a fence is not a biological threat. It is just being a dog. That brings us to a highly damaging myth: the idea that any dog or cat that bites someone must be immediately destroyed to test its brain for the virus. Instead, public health officials worldwide rely on a specific non-lethal protocol for domestic dogs, cats, and ferrets. It is known as the 10-day observation rule. This chart maps the progression of the virus. A rabid animal only sheds the virus in its saliva for a very brief window, typically 3 to 10 days, right before the disease destroys its brain and kills it. If a dog bites you and it is still alive and acting normally 10 days later, the clinical proof is absolute. It is biologically impossible for the rabies virus to have been in its saliva on the day you were bitten. The 10-day rule proves we don't have to choose between human safety and animal welfare. We can guarantee the victim is safe without executing an innocent pet out of panic. If bitten by an animal with an unknown vaccination history, the first step is surprisingly simple. Wash the wound vigorously with soap and water for 15 minutes. Soap literally rips the virus's fragile outer envelope apart and flushes it away. Then, go to a doctor immediately. If they determine there is a risk of exposure, they will administer post-exposure prophylaxis, or PEP, a specialized series of immune injections. As long as this treatment begins before symptoms appear, human rabies is 100% preventable. We also need to recognize why bites happen. The vast majority of animal bites have absolutely nothing to do with infection. Dogs bite because they are provoked, stressed, in pain, or teased. The responsibility falls on us. Don't crowd or tease pets. Keep their vaccinations up to date, and give unfamiliar wildlife space. Louis Pasteur gave us the medical tools to survive a rabies exposure over a century ago. By combining this science with a better understanding of animal behavior, we can drop the panic and safely share our world with animals.